All right, let's go to the Tavistock issue. Now, if you're a regular viewer, you will know all about Tavistock. I've brought you that story for a number of years, all the concerns about this gender clinic. It was funded under the NHS. It was the only one in the country that dealt with children. Well, it was formally shut down last year after a review concluded that it had failed vulnerable children, many of whom were rushed into irreversible treatments. There's a book out from a BBC journalist out this week. Her name is Hannah Barnes, and it lays bare the reality of the clinic. In it, she talks about kids being put on puberty blockers and hormone drugs after only one face-to-face clinical assessment. And more than a third of young people referred to this service had moderate to severe autistic traits, compared to under 2% of children in the general population. Now, if you think it's just happening in the UK, Tavistock is the guideline model for these sort of clinics right around the world, including in Australia. Someone who has written about Tavistock extensively for a number of years is my next guest, Bernard Lane. Bernard, thank you for your time. This book from Hannah Barnes, incredible detail, statistical analysis. I don't imagine you're surprised by the revelations, but I've got to ask, people are asking at home, aren't they? How on earth was this allowed to operate for as long as it did?
Well, that's one of the questions that Hannah Barnes sets out to answer. It's true that there were concerns expressed internally by typically psychologists within the Tavistock clinic, but it didn't lead to any change. There were various points at which the National Health Service should have looked at what was happening, the incredible expansion in patient numbers, the lack of a good evidence base. Eventually, it took whistleblowers to go to the media, and the UK had much more robust searching coverage of the Tavistock than we have of the clinics in Australia.
Tell us about the clinics in Australia. I mean, people would be surprised that Tavistock was basically the blueprint for these sorts of children's clinics, and that we have some based on the Tavistock model.
Yes. That's right, Peter. We have 3 large gender clinics in children's hospitals in Melbourne, Perth and Brisbane. There's probably also gender medicine being distributed by other means, but we know a bit more about those large clinics. The clinic in Melbourne, which is the biggest and most influential in Australia, at the Royal Children's Hospital, staff at that clinic made a visit to the Tavistock, I think around 2015 or 16, to learn from their model. The models are slightly different, but in the broad, they are both gender-affirming clinics. They are both giving puberty blockers and cross-sex hormones. They both have this massive increase in mostly teenage female patients with all sorts of other problems, which may be the real problems, non-gender problems, such as autism or depression or family trauma.
So if we've had an inquiry about Tavistock overseas and it's got all these terrible revelations that led to it being shut down, surely we need some sort of inquiry just to make sure that what we're doing here is not following that bad example.
You would think so, Peter, but we lack high-profile politicians who are aware of this issue and are willing to take the flak that will be inevitable. There will be cries of transphobia, as there was, when whistleblowers at the Tavistock tried to raise concerns. But I think one of the differences is that here in Australia, the public broadcaster, the ABC, their high-profile programs, Four Corners, Australian Story, have uncritically promoted this gender medicine and the Royal Children's Hospital in particular, whereas in the UK, Hannah Barnes worked for the Four Corners equivalent, the BBC Newsnight program, and that program did very dogged and persistent investigative reporting. So without that kind of media coverage, it may be that our political class just doesn't feel pressure to have an inquiry.
I imagine one of the ways the federal government and senators could be involved too, in particular, is the way in which Medicare funds. I mean, I know a lot of these clinics are run under the auspices of state governments, but the Medicare provider numbers, the item numbers that are used for the provision of some of this treatment, that falls into the realm of the Commonwealth. And I'd say through the TV to senators who might be watching, this is where they could at least have an inquiry to be sure that we're not doing to a generation of children in Australia what we've seen end up in the courts in the UK and lives ruined.
That's right. And these girls in the gender clinics are being given synthetic testosterone drugs, which, as you say, are subsidised federally by the taxpayer. And it's a very serious form of medicine.
All right, well, we'll see what happens with that, Bernard Lane. I know it's a difficult topic. I know it comes with criticisms for even touching the subject matter, but if we don't, we'll never have the transparency that we've seen in the United Kingdom. Thank you for your time.